This is Lance Lichter for AA Today. Lung injury occurs in normal patients during general anesthesia. Lung diffusion for carbon monoxide is commonly used to examine the diffusing capacity of the lung for carbon monoxide, a common assessment of pulmonary gas exchange. Similarly, pulmonary surfactant protein type B can serve as a marker of damage to the alveolar capillary membrane. Impaired oxygenation during anesthesia, even for patients with normal preoperative lung function, is a common finding. The authors used lung diffusion for carbon monoxide to examine how anesthesia, muscle paralysis, and positive pressure ventilation affected lung diffusion for carbon monoxide and pulmonary surfactant protein type B in 45 consecutive patients undergoing scheduled extrathoracic surgery without laparoscopy. The authors discussed their results in the article, The Effects of Anesthesia, Muscle Paralysis, and Ventilation on the Lung, Evaluated by Lung Diffusion for Carbon Monoxide and Pulmonary Surfactant Protein B, which was published in this month's issue of Anesthesia and Analgesia. During anesthesia, the authors used volume-controlled ventilation, 6 to 8 milliliters per kilogram of predicted body weight. Total intravenous anesthesia was used so as not to interfere with lung diffusion for carbon monoxide measurements. They found that gas exchange was significantly impaired. The impairment was mainly due to a reduction in lung volume, but also to a reduction of the gas exchange coefficient. Though these reductions were seen immediately after induction, there was no further decrease in value at 1 and 3 hours after anesthesia initiation. The authors found no difference between smokers and non-smokers. Alveolar damage related to an increase in pulmonary surfactant protein type B was present after 1 hour and was increased even more at 3 hours. Finally, lung damage was directly correlated with dynamic lung strain and reduced perfusion of the aerated lung. Given the popularity of lung injury manuscripts, this paper will likely be heavily cited in future publications. For links and more, go to aatoday.org. That's AA, the number 2, day.org. This is Lance Lichter.